Hi everyone, good evening. Dr. Sanjiv here from rampalsurgery.com. So we'll just wait for a little while so that everyone will get back on live. So today we'll be talking about ankle injuries. Hi Kevin, thank you for joining us. So we'll just wait for 1 to 2 minutes and for everyone to join in. And when we have everyone in about 2 minutes time, we will start. Hi Gurangil, thank you for joining us. So while I'm here, just to remind y'all that y'all be able to get information about patient education on the website of www.rampalsurgery.com. So we'll just wait for a little bit longer to get everyone online, and we will start our short talk about treatment of ankle pain. Thank you, Huzrin, for joining us. So we're just going to wait for another 1 minute and then we're going to start, yeah? Okay, we're just going to start then, yeah? And thank you so much everyone for joining us today on rampalsurgery.com on Instagram Live. Today we'll be talking about something that is quite common, that is ankle sprain. So ankle sprain, as everyone knows, is over the ankle and it's weight bearing, and it's one of the most commonest problems that is faced by patients all around the world. There's about around 2 million patients that usually come annually to the emergency department for various issues about ankle sprain. Ankle sprain is usually seen in patients who have a fall, who have rolled on their knee, rolled of the ankle. I'm quite sure that all of us have at some time duration of our lives have actually rolled our ankle, and usually inwards kind of movement, and we twisted our ankle and it's really painful, and you usually remember it. Usually the patients that come is usually due to fall and also activities in sports activities that is famous globally is usually have to do with physical activity and contact sports, things like rugby, sports like futsal, football, and locally in Malaysia more towards badminton, tennis racket sports is also famous for having this kind of injuries. So 90% of is usually an inwards injury, and you have pain on the outer part of your ankle, yeah? And this is usually associated with when do you actually know when you injured your ankle is usually when you have pain, you have significant pain. That means pain out of proportion over the ankle of the affected limb. You cannot continue your activities like you're playing sports or anything like that, or you could have slipped and you could have injured the ankle so little that you can actually continue your sports, especially in sports players. And there's varying degrees of injury. So your recovery time from an ankle sprain would depend actually on the initial injury, whether it is high impact or high trauma or high velocity injury, or a short or a mild velocity injury. So they usually, now let's take a sample of a bone over here, and this is an ankle, a model of an ankle, a plastic model of an ankle, where this is the right limb, a right lower limb, where you have the inner bone over here, that is the tibia, the outer bone that is the fibula, and also the talus over here and the calcaneum below that. So the articulation of the ankle is usually just these two bones, right? It's supported by the lateral side on the fibula. So they are actually protected. This is actually a superficial bone, a superficial joint that can move upwards and downwards, as you can see here. Yeah, and they are supported usually by soft tissue or what they call tendons. So I represented the tendons with this rubber band, and it's an easy way how to look at it. So actually, a sprained ankle is actually an injury of soft tissue, or what they call as tendons. Tendons are basically the elongation of a muscle that inserts into the bone, and they are thread-like or something like a rubber band. So there's three types of injuries of the sprain. It can be stage 1, that may be a stretch, right? The stretch of the sprain, that is called stretching of the tendon, does cause pain, swelling, and also inability to continue activities. And then there is a stretch and there's a tear. The tear can vary from a small minor tear that is up to 10% of the thickness of the tendon, up to complete tear that is the discontinuation of the tendon itself. Yeah. So if there's discontinuation of tendon, then it's a severe injury to the ankle, and it might have been associated with other injuries, and hopefully not a fracture. Yeah. All right. So where is usually the pain? The pain is usually in the outer part. Yeah. And now when you have an injury of the ankle or a sprain of the ankle, a good question would be, when should I go see a doctor, or when should I just self-treat it? Which I'll be showing you some information right now about how to treat it at home. So basically, when do you go and see a doctor is when you have too much of pain. When the pain doesn't resolve after 2 to 3 days, or there's severe pain that you can't even continue walk. Usually I give a rough figure, a ballpark figure of, if you're unable to walk 2 to 3 steps, right, and you cannot bear weight at all on the ankle, I think that would be a good reason for you to go get some medical attention. Yeah. And it might be due to other injuries, including when a sprained ankle. A sprained ankle can also be associated with further damage that also can be a chip fracture, a complete tear of the tendon, and also some cartilage, which is actually basically the smooth part of the joint, right? And this smooth part of the joint is called cartilage, and it doesn't come back. And injuries like this do cause severe swelling, bluish discoloration, basically a ballooning of the joint. When there's severe injury to the joint and there's cartilage injury or fracture, there'll be ballooning of the joint, and this would indicate something that would need a specialized treatment and also need attention from a doctor. All right. So now we come to the part of the talk where what can we do? What can you do to treat this ankle sprain or ankle injury? Yeah, the first thing is to immobilize the joint, or to rest the joint, meaning you need to start. A good recommendation would be to use crutches, to not weight bear. That means do not walk on it, do not stand on it, and that would be the first step. You also can use things like braces, right? An ankle brace, some crutches, a boot cast. But it all depends on how severe the injury is. And initially, for the first 24 to 48 hours, I would recommend you use some crutches. Yeah. Okay. After that, within 30 minutes, I would suggest you to use ice packing. Ice packing. How much of ice? Pack the ankle with a numerous amount of ice in an ice pack that is conveniently available for a cheap price. Also, besides that, you can just get a cloth, put some ice on it, and just ice it. The faster the better. Within the first 30 minutes would be recommended. And how long would you do it? You would do it I would recommend 10 to 15 minutes of ice compression, right? And continue this. Don't do it too long. keep it for about 10 to 20 minutes, and after 10 to 20 minutes, give it a rest and compress it, right? Compress it. What would you use? You can use elastic bands, you can use compressive bandage, but there's a method of doing it which I cannot describe right now, but something like this, this is obviously for the knee. It's a cloth brace, but you should use something to compress the region for the first 48 hours. And also do not compress it too much until you have numbness or bluish or discoloration of the region. So now what do you do what happens when you put ice on it? You're actually trying to prevent swelling. You're trying to deal with the swelling, because actually swelling does help. It aggravates a lot of blood, and this prevents this. It causes vasoconstriction of the region and also enhances healing. Yeah. So besides that, we also a good idea would be to use over-the-counter medications. That means medications that you do not need a medical doctor's prescription for this. So things like acetoamine or paracetamol will be a good choice. Also a muscle relaxant that may or may not need a prescription, depends on the brand. Also tropical ointments, non-steroidal anti-inflammatory drugs that is given in certain packaging, including sprays, gels, patches. All of this helps. Yeah. And another thing not to forget, you can use this in combinations. They're relatively very safe. They do not affect your kidneys, and they also causes the limitation of the swelling, and it causes pain relief. This all enhances your capability of recovery of the ankle injury. Besides that, you also need to continue to elevate the limb whenever you can, and by far elevation of the limb above the level of your heart. That means lying down and making sure the limb is actually above the level of the heart helps the lymphatic drainage and also the overall healing of the swelling and also the injury. Yeah. So now a lot of questions, a lot of patients. So a lot of patients of mine ask me, like, how long can I not if I'm injured, if I get an ankle injury, how long am I out for? Or in competitive patients who indulge in competitive athletic or competitive sports, it's important for them to basically find out how long this recovery is going to take. So basically a ballpark figure, or what I usually tell them is, your recovery will always depend on the level of injury. So if you have severe swelling, ballooning of the joint, massive redness, a bluish discoloration of the ankle, then you'll be looking at a longer time of recovery. This would need specialized treatment and also some form of rehabilitation and physiotherapy, and it would extend a simple sprain or mild injury would take you 4 to 8 weeks to recover, and something like that is in grade 2 or grade 3, which is incomplete tear or complete tear of the tendon, would continue to have problems and have rates of recovery that would extend to about 16 weeks, right? 10 to 16 weeks. So it depends on the level of injury and whether there's articular damage and also other associated injuries. So another thing not to forget is, nowadays we're going into a philosophy of actually life is motion, and we got to start moving more faster. We encourage our patients, and it's also scientifically proven that motion should be encouraged, especially passive range of motion. That means that let's say your left ankle is your right ankle is the one that is affected, and it's swelled up over here. So passive range of motion would include you using your other leg or your other hand to actually passively move the limb slowly. This should be started around 1 to 24 hours after the injury, and with elevation and with ice compression. So in short, when you have an injury, know when you need to go and see a doctor. And if it's a mild injury and you can continue walking or doing your sports, then coming home and elevating the limb, ice packing the limb within 15 to 20 minutes or within the first 30 minutes it'll be encouraged. Elevate the limb, have some form of this compression over it, either with bandage or something like that. Protect the ankle by using a brace, crutches, not a weight bear, and also using over-the-counter medications would be a good idea in dealing with ankle sprains. Now, even more important, as we all know, prevention is better than cure. So what can we do to prevent an injury to an ankle? So now these are general prevention methods in dealing with ankle sprains. So a good method would be one, to be cautious about the foot placement, especially when you're walking in uneven grounds. In my opinion, you should forget about this going uphill and low hill. Is more getting your exercise done on a flat surface that be encourages. So now let's say if you need to do it in uneven ground, well, make sure your foot placement is there. Make sure also your core strength, you do core strengthening exercises of your ankle. Plus also do stretching before your activity and after your activity. Yeah, and this would include when you're practicing or you practice sports either competitively or semi competitively. Stretching, warming up and warming down is ideal in prevention of ankle injuries. Besides that, having proper shoes. What they mean by proper shoes? Proper shoes, that means that it has a grip and the rubber gripping it's still intact. And if it's worn out or it's semi worn out, a good idea would be to deal with the problem, because it prevents slipping and also twisting of the injury. Besides that, improving balance and improving coordination would be a good idea in dealing with ankle sprains and to prevent ankle sprains. So stretching, modifying the lifestyle, and preventing also repetitive movements that is of high risk, meaning going in uneven ground, trekking, especially trekking, and certain types of activity or sports, especially when indulging in contact sports like rugby and soccer and futsal. These are all activities that would benefit from all of these methods of strengthening your muscles, strengthening your core muscles of your ankle, also stretching, warming up, warming down, making sure proper footwear, and also making sure that your grip on your shoes are in proper order. So anyway, this comes to the end part of my talk, or a short talk about sprained ankles. I'd like to encourage you all to ask me anything in the comments below, or you can reach me on my website www.rampalsurgery.com. And I thank you for joining us today, and hope to see you soon. Next week we'll be having another talk, two talks actually on Rampal surgery. We'll be talking about what is over-the-counter medicines. We'll be joined by our pharmacist over here, and we'll be talking about what are the available over-the-counter medications that you can take. And also I'm also joined with some of my good colleagues who indulge in humanitarian relief during the COVID-19. I'd like to thank you everyone, and do enjoy and have a great weekend. Bye bye. See you.